We live in this super connected world, right? And for modern healthcare, that creates this massive challenge. How do you keep taking care of patients when, at any moment, a cyber attack or even an internal glitch could bring everything to a standstill? And let's be clear, this isn't just an IT problem. At the end of the day, it's a fundamental question of patient safety. No, seriously, just imagine it for a second. What happens when your local hospital just goes offline? Suddenly, doctors can't see your health records. Life-saving treatments, they get delayed. Surgeries, pushed back. The entire digital heartbeat of the hospital just stops. And they're forced to go back to pen and paper, which, let's be honest, is slow and way more prone to dangerous mistakes. And the cost? It's just wild. $7,900. That's how much the average hospital loses, not per day, not per hour, per minute that its IT systems are down. But the real cost isn't measured in dollars. It's measured in the real-world impact on patients, delayed care, compromised treatments, and serious risks to their health. And that's why the whole game has changed. See, the old goal was to prevent every single problem from ever happening. But that's just not realistic anymore. This quote from Jason Kohler absolutely nails it. The new standard is all about building a system that can take a punch and stay on its feet, making sure patient care can go on without a hitch.
Okay, so here's what we're going to cover in this explainer. We'll start by looking at this two-front war that healthcare is up against. Then, we'll see why the old ways of defending hospitals are breaking down. After that, we'll dive into this whole new idea of resilience, both for fighting off cyber attacks and for making systems smarter from the inside. And finally, we'll tie it all together to see what this really means for the future of patient safety.
All right, let's get into it. Before we can even talk about solutions, we've got to understand just how big this problem is. And the thing is, modern healthcare is basically fighting a war on two separate fronts. There are threats coming from the outside, for sure, but there's also a battle against chaos happening right inside the hospital walls. So on one hand, you've got this constant barrage from the outside. I mean, we're talking about really sophisticated ransomware attacks, phishing emails powered by AI that are almost impossible to tell from the real thing, and hackers getting in through other companies that the hospital works with. But at the same time, you've got this internal struggle. Doctors and nurses are literally drowning in data. They're suffering from alert fatigue, where you get so many warnings you just start tuning them out. And all of this is often running on ancient, vulnerable computer systems. And if you look at the numbers, they're pretty scary. Ransomware attacks on healthcare, they're up 94%. In 2023 alone, over 100 million people had their data impacted by these attacks. And that huge Change Healthcare breach, that hit 190 million people. It's massive. And a big part of the why, a whopping 85% of these organizations are still relying on old, outdated systems. It's like leaving the front door wide open. All of this just goes to show one thing. Really. The old way of thinking, building this giant digital fortress around the hospital to keep the bad guys out, it just doesn't cut it anymore. That wall is more like Swiss cheese. And this quote from EY just lays it out perfectly. There's no such thing as a secure perimeter anymore. Think about it. You've got cloud systems, people working from home, thousands of medical devices all connected to the internet. The idea of one single wall around everything, it's pure fantasy. You have to work from the assumption that the attackers might already be in.
This table really breaks down the huge shift in thinking that's needed. The old model was all about prevention, right? It was based on this hopeful idea that you could stop every single attack. But the new, resilience-based model, it starts with a totally different, more realistic idea. Attacks are gonna happen. It's inevitable. So the focus isn't on stopping them all, it's on making sure that when they do happen, the damage is minimal and you can get back up and running, immediately.
Which brings us to the heart of this whole thing, this new mindset of resilience. It's not about being unbreakable. It's about being able to bend without breaking. It's about adapting and even getting stronger when you're under pressure. And that's what we're calling clinical resilience. Basically, it's a hospital's ability to take a hit. Doesn't matter if it's a ransomware attack or a hurricane, and still keep taking care of patients safely and effectively. It's a really important shift. We're moving from just protecting data to protecting the actual delivery of healthcare itself. Okay, so this all sounds good in theory, but what does it actually look like in practice? Let's start with that first front we talked about, fighting back against those outside attacks. And that's where something called cyber resilience comes in. So a good cyber resilience plan has a bunch of layers. Yeah, you're still trying to prevent attacks, that doesn't go away. But you're adding on top of that. You're constantly monitoring every single phone, laptop, and medical device. You've got rock-solid backup and disaster recovery plans. You're training every employee. And this part's key. You adopt a zero-trust approach, which basically means you don't automatically trust anyone or anything on your network. Pair that with real-time monitoring, and you can spot and stop a threat in minutes instead of finding out days later. But here's the thing. Clinical resilience isn't just about fending off hackers. It's about surviving any kind of disruption, whether it comes from outside or inside. So we also have to win that second battle, the one happening inside the hospital walls. It's all about taking that crazy mess of data and turning it into something that can actually help save lives. And the way they're doing this is by creating something called learning health systems. It's a really cool idea. It's all about creating a constant feedback loop. The hospital collects data, learns from it, changes how it does things, and just keeps getting better and better. It's a perfect example of internal resilience in action. Okay, let's use a real-world example to make sense of this. Sepsis. It can be deadly, so a lot of hospitals have systems that automatically alert doctors. Sounds great, right? But what if that system is just a little too trigger-happy? Suddenly, nurses and doctors are getting flooded with false alarms. They get what's called alert fatigue, and they start to tune it out. And then a real life-or-death case could get missed. See? That's not a hacker. That's the system itself failing from the inside. This is exactly where a learning health system shines. It tackles the problem step by step. First, you measure everything. How accurate are these alerts? How fast are people responding? Second, you learn. You analyze the data and realize, whoa, we have a huge false positive problem. Third, you improve. You get the tech folks and the medical folks in a room, and they agree on a small change to the alert rules. And then, and this is super important, you remeasure. You collect more data to make sure your fix actually worked and didn't accidentally create a new blind spot. That cycle, right there, builds resilience. At the end of the day, this whole approach is about one thing: clarity. The goal is to design for one decision. So instead of throwing a dashboard with a dozen confusing charts at a busy nurse, you build a system that answers one simple, critical question. Something like, does this specific patient need to be checked for sepsis right now? It gives them a clear signal and a clear action to take. It just cuts through all the noise. So when we look at the future of patient safety, it's not an either-or situation. It's not just about building a stronger wall against hackers or creating a smarter internal system. You have to realize they're two sides of the very same coin. That coin is clinical resilience. A truly safe and healthy hospital has to have both. And if there's one thing you take away from all this, it should be this: cyber risk is not just an IT problem anymore. For way too long, it was treated like this separate thing that only the tech geeks had to worry about. Those days are over. Everyone, from the CEO down to the board of directors, has to get it. Being resilient to cyber attacks is now a fundamental part of patient safety, period. And if you're still not convinced this is urgent, check out this number: 1,357. That's the average number of cyber attacks a healthcare organization had to deal with every single week in early 2025. This isn't some far-off threat that might happen one day. It's happening right now, all the time. So, we'll leave you with a question to think about. Because in the world we live in now, it's really not a question of if a hospital will face its next major cyber attack. It's only a question of when. And being ready for that day isn't just about keeping data safe. It's about keeping people alive.